Hello, everyone. Thank you for joining us on our webinar today. I am Carrie Finley, and I, along with my colleague Jay Otto, are excited to talk with you about the Applying Traffic Safety Culture project in Minnesota, and to share data about what we learned about the culture of impaired driving in Park Rapids, Minnesota. So for those of you who are unfamiliar or might not be a frequent user of WebEx, Kelly, go ahead and the next slide. You can join the audio either by phone or by computer. You can click on the phone icon at the bottom of your screen to connect to the audio. And you're welcome to use the chat box to send us questions. Jay and I will be looking at those and we'll answer those at the end of the webinar. And finally, we're going to record this webinar, so it will be available to you on our Center for Health and Safety Culture website. My colleague Jay and I are research scientists at the Center for Health and Safety Culture at Montana State University. Next slide, please, Kelly. The Center for Health and Safety Culture is an interdisciplinary center, and we conduct research on how culture impacts health and safety. We conduct applied research in partnership with communities and states and tribal and national organizations who are seeking to improve health and safety. So all of the work that we do is applied in partnership with communities. Next slide. Our work predominantly covers four topics: traffic safety, substance misuse, violence, and child well-being. And when you think about it, together, these issues have a profound impact on public health. They are the leading causes of potential years of life lost. And they overlap. So we know that the misuse of substances has a profound impact on traffic safety. And likewise, violence and child maltreatment are impacted by substances. And all of these are interconnected. Working in these domains is really insightful for us because our big picture goal is to step back and look at our overall approach and how that transcends any given issue. Next slide. On today's webinar, we're going to talk about the Applying Traffic Safety Culture project that we have been working with in Minnesota at a high level. We'll talk about what we did in the phases of this project over the course of 3 years. And then we're going to share survey data about the culture of impaired driving. And finally, we'll wrap up our webinar with a discussion of next steps for this project. So we know, next slide. In 2018 in Minnesota, there were more than 79,000 traffic crashes. 381 people lost their lives and over 27,000 people were injured. There was an economic cost of $1.8 billion. And while we know engineering solutions have significantly reduced traffic-related fatalities over the recent decades, road user behaviors remain the most common risk factors associated with traffic crashes. Interestingly, in traffic safety, we are increasingly moving beyond seeking only engineering solutions to improve traffic safety, but seeking new methods and applying new methods to change road user behavior choices. We're increasingly realizing that in order to achieve our goals of zero fatalities and serious injuries, we need to create a traffic safety culture that prioritizes safety and encourages safe road user behaviors, and that facilitates cooperation amongst stakeholders. Next slide. We know that an individual is influenced by their social environment. So when we seek strategies to improve traffic safety, we need to look at strategies across the social environment. The social environment includes an individual's family and their peers and school, the workplace, at the community level and at the state level. And an individual really learns from these nested layers of relationships. Collectively, these layers convey a community's culture. Each layer can contribute to improved traffic safety and together have a significant impact on influencing the road user behaviors. For example, if a passenger in a vehicle can speak up if they see a driver who's engaged in a risky behavior. Or a family can create family rules about safe driving behaviors, like wearing a seatbelt, or in this family, we never drive distracted or impaired. Workplaces can also influence individual behaviors and road user behaviors by establishing policies and provide training about safe driving practices. And communities and state officials can pass policies and laws. Collectively, these decisions result in behaviors that reduce traffic fatalities and serious injuries. Next slide. The focus on the influence of the social environment on road user behavior has been termed traffic safety culture. More formally, traffic safety culture is defined as the values and beliefs shared amongst a group of road users and stakeholders that influence their decisions to behave or act in ways that affect traffic safety. Road users include all the participants in the roadway transportation system. And road user behaviors include the actions that can influence crash risk and severity. Importantly, this definition also applies to stakeholder actions as well. Next slide. So this project is the Applying Traffic Safety Culture project. It's a 3-year pilot project that we have been engaging in to apply traffic safety culture in a community. So this project brought together myself and my colleagues from the Center for Health and Safety Culture, the Minnesota Department of Transportation, and Chi St. Joseph's Health in Park Rapids, Minnesota. It brought us together to increase health and safety by understanding how culture impacts traffic safety behavior in a community. Also, we started to create common language and common understanding and a portfolio of strategies to positively impact traffic safety culture in Park Rapids, Minnesota, which was our pilot community for the project. And as a pilot project, really the goal of this project was to create a foundation for applying traffic safety culture in a community, to plan efforts, and to mobilize collaborative partnerships. This project focused on the process of applying traffic safety culture in a community. Next slide. So this project was divided into 3 phases, and we used the positive culture framework to inform and develop the tasks and activities that were completed in each phase. So for example, in phase 1, we really focused on establishing working and collaborative partnerships with stakeholders in the Park Rapids community, and to better understand the traffic safety culture in Park Rapids. The Park Rapids community already had a prevention coalition called Hubbard in Prevention. And with the initiation of this project, the stakeholders in the community decided to reconvene a traffic safety work group that had been going at some point and then had kind of disbanded into the larger Hubbard in Prevention. And with the initiation of this project, they decided to reconvene that traffic safety work group. In this phase of the project, we created a portfolio map of strategies to understand really what strategies were already being used in the community to influence traffic safety. We conducted a cultural assessment, and we looked across the social environment. We conducted a cultural assessment of community adults and students and workplaces and law enforcement to better understand the values, their attitudes, beliefs, and behaviors about 2 traffic safety issues: distracted driving and impaired driving. And then together, the stakeholders really came together and went through a prioritization process. And through that process, they selected impaired driving as the focus issue for this project specifically. In the second phase of the project, we really focused on developing traffic safety culture strategies to address impaired driving. So we looked at the literature to identify existing strategies to reduce impaired driving and what those strategies were across the social environment. We gathered the existing strategies that were already being implemented in Park Rapids. And the stakeholders in the community engaged in a process to then select the strategies that they wanted to plan efforts and work to implement. So the traffic safety work group in Park Rapids focused on 4 strategies that they'd selected to plan for and implement in this project. And then finally, the last phase of the project, phase 3, was the focus was really to allow the community to implement their selected strategies and then to again conduct a cultural assessment. So again, we came back into the community and did a cultural assessment of community adults and students and workplaces and law enforcement. And we want to share with you what we learned from that cultural assessment. I will share that with you now. Next slide. And to do that, I'm going to turn the presentation over to Jay, my colleague, to share the data about the culture of impaired driving and to discuss what we learned from that data.
Great. Thank you very much, Carrie. This is Jay Anto with the Center for Health and Safety Culture, and we can go to the next slide. There's potentially a lot of information we can gather when we start thinking about approaching traffic safety from a cultural lens. So this is a very simplified behavioral model showing a relationship between values that individuals may have, their attitudes and beliefs about behavior, their willingness and intention to engage in a behavior, the behavior itself, and then that behavior potentially leading to health outcomes. And this is a good way just to break down some of the data and to organize it. And we actually, we collected data largely about the beliefs and some of the self-reported behaviors, but there's also data available about the health outcomes. So we were able to pull all this data together and share it with the community in what we called sort of a cultural summary. And so we're going to walk through it just the way we walk through it with the community. And we're actually going to walk through it from right to left. So we're going to actually sort of begin with the end in mind and look at some of the health outcomes, and then back up and look at some of the behavior, and then look at some of the beliefs associated with that behavior. So that's how we'll structure the review of the data. If you can go to the next slide. The data sources that we used for looking at people's values, attitudes, and beliefs, and their self-reported behavior were 2 core instruments. We did a random sample of households in Park Rapids with a written survey. It was a 4-contact mailing, and it was done in 2017, and then the same instrument was repeated in 2019. It was not the exact same sample between the 2 years, so each year, each survey, we drew another random sample. And you can see the number of responses back and the participation rates were pretty good. We also conducted a similar, but it was adjusted survey for high school students. So where we could, we kept the questions the same, but some of the questions, it made sense to adjust them a little bit. We had some additional questions about underage drinking, and we changed the referent groups on some questions to talk about their peers instead of talking about other adults. And this was done as a census of all students in the high school. We had very good participation rates. The high school was wonderful and very helpful in participating. And you can see good participation rates by the students. So these are the sources of some of the data that I'm going to share. There are a lot of numbers that are going to be coming through, so I've tried to help color code it a little bit. The blue represents the 2017 and the black represents the 2019. And we'll try to walk through it slowly, but I recognize there are going to be quite a few numbers that are coming. Okay, so if we begin, we're going to sort of go column by column at looking at this behavioral model, and we're going to begin with health, the outcomes. And in this context, the community had prioritized alcohol-related car crashes. As Carrie said, we initially looked at 2 broad behaviors, impaired driving and distracted driving, and the community elected to focus on alcohol-impaired driving. So that's the core information that we're looking at. So if you go to the next slide, some of the data we have on this, and I just brought in some national data as well, just to help a little bit of a context. So you can see as many of you probably know, we're still looking at slightly less than a third of all fatal crashes involve alcohol in the United States. We don't have the most recent numbers, but those will be coming in soon. Hopefully it's gone down a little bit, but I'd imagine it's going to be somewhat similar. The numbers are somewhat similar in Minnesota. We're looking at about a third again involving alcohol. And then in Hubbard County, we were able to look at some data there. Those numbers have to be aggregated over multiple years because we're getting into very small populations. And even we have to be careful attributing too much information or meaning to these numbers because they are very small, and one crash can really change them significantly. But overall, just to set a context, alcohol still is a major contributing factor to a very significant portion of the fatal crashes we see. Okay, if you want to go to the next slide. So now we'll look at some of the reported behaviors. And what we wanted to do is look at driving within 2 hours of consuming alcohol. That doesn't necessarily mean that somebody who drives within 2 hours would be over, let's say, a BAC, a blood alcohol content of 0.08, or they might not be legally impaired. But what we wanted to look at was just the general behavior of even driving after drinking. And ultimately, I think what we're trying to do from a big picture is to shift the entire curve, right? Not only do we want people who are driving impaired not to drive impaired, but really we may look at shifting the whole curve of really just not driving after drinking. And other countries have reduced their blood alcohol content legal limits below 0.08. Some are 0.05. Some have moved to 0.02. And even in the United States, we have Utah that's moved from a 0.08 to a 0.05. Then we also asked a question which is similar, which is the CDC asks on the behavioral risk factor surveillance system about drunk driving. So we wanted to look at both of those behaviors just so we could get a feel for what was, what people were engaging in. Okay, if you go to the next slide. So what we see is about 3/4 of the adults report they have not driven a motor vehicle within 2 hours of drinking any alcohol in the past 30 days. And that number was very similar between 2019 and 2017. And we just want to pause here. We are framing the data in terms of a positive culture. That's part of our intent, is to look at the positive culture and see how we can grow it. This is often drastically misperceived by people. People perceive that, a lot of adults drive after drinking, but really most do not. And so we're in a good position to continue to grow this healthy behavior and even decrease the number who drive after drinking at all. And then overwhelmingly, most adults do not drive after having perhaps too much to drink. Nonetheless, a small percentage of people who do engage in that behavior can cause tremendous amount of harm. So it doesn't take many people engaging in such a risky behavior to cause a lot of harm. So really, that number has to go well below 1% as we work towards the future. Really, we want that parts in 1,000 or parts in 10,000. And so it's valuable for us to look at both of these. Statistically, neither of these data points changed between the two measures. And honestly, we weren't anticipating much change. This was a very short project. It was involved a lot of planning efforts, and we weren't anticipating seeing a lot of change in behavior in such a short period of time. Okay, we can go to the next slide. So we also asked questions of students. We wanted to see what they were doing. First off, the majority of students, and these are students in grades 9 through 12, report they did not drink alcohol in the past 30 days. It would be illegal for them to drink alcohol at this age. We still have about 21% who indicated they were drinking, and we're very concerned about that. But again, from a positive culture standpoint, most students are not drinking. Overwhelmingly, their students report that they've not driven a motor vehicle after using alcohol in the past 12 months. That's good, but you can see 12% are reporting that, which is very concerning. These are younger individuals. They have less driving experience. So alcohol can be a significant risk factor as well as just novice driving, and significantly increase the likelihood of them being in a crash. We can also see about 30% of them indicated they had ridden with a driver who had been using alcohol. That driver could be a fellow student. It could be, an adult. It could be their parent. But we're also concerned about those behaviors. So again, we've got some good positive norms here to grow on, but we've got some room to grow. And there were no statistically significant changes between 2019 and 2017 with these data points. Okay, so that gives us a little bit of context for the behavior. We're going to not go through and look at the detailed data on willingness and intention. You can see on the screen the kinds of things we looked at. We looked at their willingness to drive within 2 hours of drinking in a variety of different circumstances. And that acts as a good intermediate variable when we're developing the behavioral models. But really, when we want to look at shifting their willingness and intention, we're going to really focus on their attitudes and beliefs in order to achieve that. So we're going to look at a variety of different kinds of beliefs to explore what, sort of what gives permission or allows people to engage in a decision about driving after drinking. So we can go to the next slide. So one thing we want to look at are some what we might call behavioral beliefs. These would inform their attitude about driving after drinking, and that attitude could be a complex set of beliefs. Like, do they think it's harmful or safe? Do they think it's sort of good or bad, or different things like that? And these are more specific beliefs, the behavioral beliefs, that would inform that. So what we can see is that the majority of adults and students agree that people who drive after drinking alcohol are more likely to get stopped by the police. So this is valuable to look at. We want to look at deterrence theory. Do people have a sense that if they were to do this, they might get caught? This is certainly an outcome of high visibility enforcement. We want people to have the perception that if they do drive after drinking or drive impaired, that they're going to be arrested. That will decrease the likelihood that they engage in it. So it's interesting just to see how they report on that. It is important to note that there are some people who are indicated that they didn't agree that they would get the likelihood to get stopped. So that there's certainly room to grow this. The second bullet point, we have the majority of adults and the majority of students agree that people who drive after drinking alcohol are more likely to be in a traffic crash. It's interesting to note that maybe that's a little bit lower among some of the students, but generally similar levels. So people get the idea that alcohol can impair driving and can increase crash risk, although those numbers are not 100%. So we have some folks who are not seeing that. We have work to do there. But overall, the general culture of the community and the population was to recognize that alcohol impaired driving increases crash risk. Now, this is another question that the third bullet is a question we like to ask, particularly around alcohol impaired driving. And do people have a sense of like, I can drink some and I'll be okay, but maybe there's just like this sudden threshold where my risk goes up. And what we know is really impairment begins with the first sip of alcohol. It's levels of impairment that we're concerned about. And really, again, if we look and take a curve shifting perspective, a really broad perspective, we really just don't want individuals to drive after drinking. So you can see about half of the adults, a little bit more of the students agree that impairment begins with the first sip of alcohol. So I think this is an area where there's an opportunity for education, and we can work on that. We want people to recognize that impairment begins with the first sip of alcohol and its degrees of impairment. The answer to that question is highly correlated to whether people are willing to drive after drinking and actually their driving after drinking behavior. All of these indicators are. The last bullet is just another way to look at do they agree that alcohol impairs driving performance? And overwhelmingly, people are agreeing with that. So that's important to see. So again, we have a better understanding of what the broad culture agrees and understands, and that helps us as we move forward with education or other communication strategies. So these were 4 of the behavioral beliefs that we wanted to look at. Again, these will inform their attitude and influence people's willingness and intention to engage in the behavior and the behavior itself. Okay, so if we go to the next slide. Now we can look at some normative beliefs. Now these are beliefs about what I perceive others do. We're going to begin with descriptive normative beliefs, which are specifically perceived norms. What do I think is typical? What behaviors do most people engage in? And normative beliefs absolutely influence whether people will do something. It's that notion, if I think everybody else is doing it, I might be more comfortable or willing to do it. If I don't think everybody else does it, I'm less likely to do it. So these are the descriptive normative beliefs. So we can go to the next slide. So what we saw is that we've got some real misperceptions here. We had about 9 out of 10 adults believe that most adults in their community did drive within 2 hours of drinking any alcohol in the past 30 days. So this is a significant misperception, right? We looked at the data earlier on. Most adults do not drive within 2 hours. So the adults are misperceiving their own culture and thinking that this is a normal and typical behavior. And that's something we want to correct. As I just indicated, the more people think that it's typical behavior, the more likely they will do it themselves. And similarly, a lot of adults perceiving that most adults in their community drove after having too much to drink. So not only just drinking within 2 hours, but driving after having too much to drink. So these are concerning misperceptions and ones that we would want to seek to correct through education, other things. We also just wanted to encourage stakeholders as they're talking about impaired driving, not to inadvertently create the perception that everybody is doing it, because that can obviously inadvertently lead to more people actually engaging in the behavior. So we revealed some significant misperceptions here. Again, those data points did not really change over the course of the project. The project did not have funding to do mass media campaigns, so we really didn't anticipate to see significant changes in this. And it's interesting to see really how stable it was over those 2 years. Okay, if we want to go to the next slide. Also, significant misperceptions among students. The students were believing that most of their peers were drinking. Now, that actually did decrease over the period. There were some parallel efforts that were going on with the Prevention Coalition, specifically focusing on underage drinking. So they were working on trying to address some of these misperceptions among students, and students a little bit easier to reach because they're more self-contained in the high school. So communication strategies can reach them. But also in a significant number of students believing that most students in their school who can drive were driving after using alcohol. That's very concerning because, again, it can give that sense of permission that it's okay to do. And many of the students believing that most adults in their community drove after using alcohol. So again, very concerning misperceptions. The data is showing that most adults are not engaging in these behaviors. Most students are not engaging in these behaviors, but that's not what people are perceiving. And so we, a critical opportunity to start to shift these beliefs. Okay, we can go to the next slide. We also looked at another group of normative perceptions, and these are what are technically called injunctive norms. We might also describe them as a sense of disapproval. So norms not only include what I think is typical, what most people are doing, but also what is expected of me, what is acceptable or unacceptable, or what is approved or disapproved. So we looked at levels of disapproval for engaging in this behavior, and that's the next group of beliefs we'll look at. So you can go to the next slide. So what we can see is pretty strong beliefs. About 2/3 of the population of adults disapprove of driving within 2 hours of drinking any alcohol. So this is strong. It can clearly be stronger, but it's a place we want to grow, right? It's interesting. In a state like Minnesota, we might hear people say, well, this is a heavy drinking state, and people are going to really push back against this notion of talking about not driving after even 2 hours of drinking. But really, most of the adults disapprove of that behavior. And so that, again, is a great place to begin and opportunity to grow that for sure. Now, we can see much higher levels of disapproval for driving after having perhaps too much to drink. And this, again, overwhelmingly, people do not think drinking and driving is acceptable, impaired driving is acceptable. We've had huge shifts on that in this country. But I think where we really want to ultimately go is towards that top bullet of really shifting, really just not driving after drinking at all. The fourth bullet is interesting. Now, this is people's perception of what other people in their community feel. So at the top two bullets are whether I disapprove. Now we're asking about, so do you think most people in your community disapprove? And here we see much lower levels. Only 40% of the adults believe that most people in their community disapprove of driving within 2 hours of drinking any amount of alcohol. And from the top bullet, we know that actually most adults do disapprove, but that's misperceived. And this can influence people in terms of being less likely to speak up, less likely to maybe actively support enforcement or other efforts that might take place. Less likely to raise a concern if they're worried about somebody else, or saying, hey, let's think about our drinking and driving behaviors before we even go out, before we even start drinking. So this is an important belief because we want to shift it to where people are comfortable having those conversations and they don't perceive a sense of a lack of disapproval by others, when in fact most people do disapprove. You can see in the last bullet, almost 3/4 of the population of adults believe that most people in their community disapprove of driving after having had perhaps too much to drink. But again, you're kind of curious about that almost 1/4 of the population who didn't think most people in their community would disapprove, because disapproval is very high. So again, that's an opportunity. We want to overcome some of these misperceptions. These misperceptions can inhibit action, permission to take steps, and they can also give people permission to engage in risky behaviors when we don't want them to. So this revealed some good positive norms to build on and some opportunity to grow some misperceptions. Okay, we can go to the next slide. The vast majority of students disapprove of driving after drinking any alcohol. So that was a strong place to begin. Again, we've got some room to grow that. We'd like that number to be, much higher than that, but it's a good place to begin. And an important just check in with young people who are obviously entering an age. We know that 18 to 25 is a very high risk period for high risk drinking and driving, and so these folks are soon to be in those ages, and we want to see what their thoughts are as they enter that time period. Okay, we can go to the next slide. So the last set of beliefs we want to look at are control beliefs. And, impaired driving is complex because when we talk about control beliefs, because once somebody starts drinking, the alcohol is impacting the decision-making processes within their brain. It's inhibiting aspects of their frontal lobe. People aren't making the same decisions when they've been drinking that they would make when they haven't been drinking. So control is important, and we have to recognize that control beliefs can really be challenged when somebody's under the influence. So we're also really looking at control beliefs that occur prior to the drinking event and things that people might do to avoid being in a situation where they have to drive after drinking. So we were particularly looking at beliefs around planning. Do you plan and think about this before? Also, do you have family rules where you're sort of talking about it as a family and establishing your family expectations? And, oh, by the way, do you have workplace rules? So these were 3 areas that we wanted to explore with control beliefs. So we can go to the next slide. So 84% of the adults plan so that they never have to drive after drinking, and that may include choosing not to drink. I think sometimes we overestimate the prevalence of drinking among adults. We sort of think that all adults drink, when in fact, there's a significant portion of adults who don't drink. But it's good to see that we have a large number of adults who are planning. We'd like that number to be higher, but there's a good place to start. But that last 16%, we'd really like to reach them. And so encouraging people to plan before you go out is a critical strategy that we can seek to grow. Much fewer folks reporting that they had a family rule about never driving after drinking. And again, having a family rule is an opportunity to have some important conversations about traffic safety as a family. It's an opportunity to do some education with children and youth. It's an opportunity to talk about, well, if we have a rule, what does that mean? How do we, enforce or engage that rule? Well, it could mean we plan. So the second bullet can absolutely lead to the first bullet, but a lot of room to grow there. And this was one of the focal areas of the community, was to try to encourage more families to have rules about never driving after drinking. And part of the strategy was to bring this up more intentionally in driver's education, which has a parent component, but really didn't have explicit guidance on, okay, what are our family rules about driving after drinking? And let's talk about that, as well as family rules about other things like wearing a seatbelt or cell phone use or distracted driving. And there's obviously a lot of things we can talk about in terms of traffic safety and family rules, but we were specifically looking in the context of impaired driving. And this bullet does remind me of a good story when we were talking with the stakeholders. One stakeholder in a meeting said, my wife and I would never drive after drinking. If we go out and we're someplace where we might have wine or something, one of us might drink and the other would intentionally not drink, so that we were always careful about that. But I've never told my son that. I've never labeled what we do. And he said, that's a really interesting idea. I think with a family rule, my son's very young, but I could explicitly label the choices that I'm making so that he would more actively learn. So it's doing things like that I think has tremendous opportunity for parents to educate their children, but also then their children can help the parents hold to a high, safe standard. Very interesting in terms of the last bullet. Oh, if you can go back one more. The last bullet, very few people indicating that their workplace has a rule about never driving after drinking alcohol. Now, many of us might say, well, is there really drinking going on at workplaces? And perhaps in many workplaces they're not. But you also do have workplaces where people may go out for lunch or other things like that. They might have an event in the afternoon. And have they just discussed, is it acceptable to have a drink during lunch and then drive after that, or other things like that? Or if you're on a sales call, is it appropriate to have alcohol, and what happens afterwards? So again, I think another opportunity in the social environment to engage and have some important conversations about how, if we agree it's unacceptable to drive after drinking in a work environment, we need to talk about that and really make that a part of our policy and our safety training. Okay, we can go to the next slide. The last grouping of cultural components that we want to look at are broadly what we consider values. Values is a really big topic, and we really wanted to specifically look at some things around just general concern about traffic safety, and then also their agreement with zero-death goals. We recognize that with values, it's not so much that we're going to change values. Values are very slow to change. They may grow slowly. Really what we're going to do with values is connect with them. We're going to anchor to them. We're going to use them to help frame things. Because when we can connect with people around shared values, we have a greater sense of trust. So understanding people's values is important. It can also be powerful to empower stakeholders to be more comfortable talking about things because they can connect back to these values, which then give them permission to maybe have some important conversations about some of the attitudes and beliefs that we just looked at. Okay, so we can go to the next slide. So in general, adults are pretty concerned about traffic safety in their community. Students were less so. So that's interesting. I think students may not realize that motor vehicle incidents, motor vehicle crashes are the leading cause of death for people, age 5 to 25. So traffic safety is a major issue for young people, but students may not get that. So I think there's an important opportunity to do some education there. But as a value perspective, you can walk into a room knowing that 7 out of 10 adults are concerned about this in this community, and that's a good place to begin. So it sort of gives permission to have these conversations. Now, it's interesting to note, we asked them their concern, but we also asked them the perception of concerns among others, and their perception of concern is lower among others. So slightly less than half of the adults thought that most people in their community were concerned, and just a quarter of, and accurately, a lot of the students weren't concerned. But this creates an opportunity, again, where people may not be comfortable talking about these things because they think everybody else is not concerned, even though they themselves are concerned. And actually, most of the adults were concerned. And slightly about half, 2/3 of adults believe their employer's concerned about traffic safety. So there's definitely room to grow there. If we talk about incidents within the workplace, injuries within the workplace, fatalities within the workplace, motor vehicle incidents is typically the leading cause of those generally. Now, it can be industry specific, but on average, traffic safety is a major safety issue for employers, and it's valuable for employers to talk more about that. So these were some of the levels of concern. We can go to the next slide. We also, I think, valuable to recognize that 3/4 of the adults and 2/3 of the students believe the only acceptable number of deaths and serious injuries on Minnesota roadways is 0. So we'd like that to be 100%, and we need to know that we can walk into a room recognizing that 3/4 of the adults agree 0 is the goal. So we need to act upon that strength. Yes, we'd like it to be higher, and we're not sure what others are thinking in terms of maybe fatalistic thoughts or that it's impossible to achieve 0. So I'm not going to agree with that. But again, I think this kind of an indicator gives us permission to sort of go there, to sort of say, look, most of us agree the goal should be 0. So let's roll up our sleeves and figure out what we can do. And of course, as we might expect, those numbers go higher when we ask that question in terms of acceptable number of deaths amongst family and friends, as opposed to the population in general. So these are, I think, again, are just anchoring beliefs, values, or anchoring beliefs that are helpful to give us permission to be able to move forward. Okay, so if we go to the next slide. So this slide really summarizes at a high level all the kinds of things we measured. We also measured some beliefs around bystander engagement, whether people would speak up if they were concerned about somebody else. We've not reviewed those here. We might review those in the future webinar. We weren't able to ask questions where we could look at a whole behavioral model around bystander intervention because the survey just becomes too long, but we were able to ask a couple of questions there. Now, what's highlighted in yellow were the only indicators that statistically significantly changed over the 2-year period. And there are a couple of things we might take from that. One is the numbers and the indicators were very stable, which is valuable from our standpoint as researchers and trying to assess culture, that the measures, the instruments we're using to do this have a sense of reliability, that we're repeating the measures and we're getting similar results. We also know that in general, cultural beliefs are slow to change. And that's good and bad. I mean, that can frustrate us because we want to see change immediately. And it's good because of the sense that as we start to shift them, they're more likely to stay that way. They're not likely to bounce around. So that's good. I think there were changes the reason that we might see changes among some of the descriptive norms among students, as I mentioned, was some of that other effort that was going on, specifically looking at those that were funded by other resources that were engaging in some communication with students in the high school. But even though we saw some changes with those descriptive norms, we didn't really see any statistically significant changes with other beliefs or behaviors among students. And that's what we've also seen in past research. Even when you start to shift descriptive norms, there's a lag before you start to see changes in other beliefs and the behaviors. It takes several years to do this. So overall, we did not anticipate seeing a lot of changes in these beliefs. I, as a researcher, am comforted by the stability that we saw, knowing the nature of the project, that it was largely a planning project, and that some of the plans are just really starting to move forward now. It takes quite a bit of time to shift these underlying beliefs. So with that, Carrie, I'll shift it back to you. That's a pretty quick review of some of the data, and I'll let you close things out.
Great. Thanks, Jay. So this project really provided us an exciting opportunity to apply traffic safety culture in a community. And we learned a lot from the project and really enjoyed working with the Park Rapids community and Angela and Marley at Chi St. Joseph's Health, and also appreciated the Minnesota Department of Transportation for partnering with us to make this project a success. So when we look at final steps or next steps, we have submitted a final report to the Minnesota Department of Transportation, and we're awaiting approval for that final report as we speak. So in the final report, we really walked through some of the key lessons and ideas that we learned about applying traffic safety culture in a community. And the final report will be available through the Minnesota Department of Transportation's website for those of you who might be interested in learning more about the process and some of those key lessons learned on applying traffic safety culture. And then also for stakeholders and people in Park Rapids and Hubbard County, if you're interested in joining these traffic safety efforts, I put Angela Graham at Chi St. Joseph's Health number on the screen, and her and the Prevention Coalition and the Traffic Safety Work Group are continuing these efforts. So I added her contact information for those of you who might be interested in partnering with those ongoing efforts. I'd like to thank you all for joining us this afternoon, and I'd like to open it up to questions if there are any. Kelly?
I'm not seeing any come in so far, but we can maybe wait a few minutes.
Great, thank you.
So you can type questions into the chat box or the Q&A box is probably the easiest way. I think you might be able to also, I'm not sure if you're able to unmute yourselves and orally share them, but typing them in is the easiest way on a webinar.
Looks like we have a question. Besides time, what were some of the challenges that were encountered during this effort?
You want to take a pass at that, Carrie, or you want me to speak towards that?
Sure. So I think when I look at the project overall, I think one of the, thinking about what made it a success and what were some of the challenges, I think having the group, the coalition and the traffic safety work group was imperative to the effort. So I think that was really good in that we needed that. I think it was just getting everybody on the same page about what is traffic safety, what is this that we're talking about and how do we move forward as a group, and just really aligning the partnerships in the beginning, I think is imperative. So I think that was an initial challenge in just thinking, how do we get everybody on the same page, moving in the same direction. And because this was really more about planning and planning efforts and building these collaborative partnerships and networks, I think that it can be a challenge to not just dive into okay, what are we going to do right now, but to really lay that foundation for success. Jay, would you agree? Would you add anything to that?
Yeah, I mean, I think that, the planning projects are tricky, especially with coalitions who want to move towards action. And that can be sort of a give and take with coalition members. It can create some, I think, a bit of frustration and things like that. I think the staff there did a great job. Angela did a great job to hold folks together and keep them, and then leveraging opportunities with other partnerships where they had resources that could then fund action, which was great. I think it is just a challenge overall with culture work is that it does take time. And we sort of know that from the misuse of substances prevention work. For example, at the federal level, Drug-Free Communities, which is a grant that works with communities to reduce various substance use among young people or adults, it's funded on a model of 5 years with a possibility of another 5 years. So it's kind of a vision of a 10-year process. And we know that's an extremely long time in terms of funding sources. And so rarely is that kind of length available. But I think they've learned over the years that this work just takes time. And so I think it is a challenge for all of us to think about sort of framing this work through the lens of long term, and then thinking about what are we achieving on the short term and the intermediate term and the long term. But that's a different way of thinking for some folks. I mean, some folks are very much used to, what's the action in the next 30 days. So I think those are all potential challenges.
Okay, great. Well, thank you for joining us today, and we will put this on our Center for Health and Safety Culture website so that you can download and access it there. Have a great afternoon.
Thanks, everyone.